Hello, welcome back to Political Science 400-500C, Public Policy for Health Security and Resilience. My name is Nathan Myers, and today we're going to be looking at the readings associated with week 2. So we're going to start with this book chapter that was included with your readings, from mad cow disease to bird flu, transformations of food safety in France. So even though there's a few readings that I've assigned that deal with how France has responded to avian influenza in the past. And obviously there are significant differences between the French government and the US government systems. But I still think that it's worth looking at how other countries have responded to bird flu. I think some of the larger lessons from those types of responses are still useful for our consideration as we deal with our own situation here in America. And this chapter is from by Frederick Keck. So the first thing that I would note from the chapter is it talks about this division between the way that veterinarians view avian influenza and the way physicians view avian influenza. So as Keck talks about, veterinarians are focused on defending the interests of animal husbandry first. It should be noted that by animal husbandry, that's not talking about the welfare of the animals in and of themselves. It's talking about the welfare of the farming industry, the agricultural industry that depends on the raising of animals for meat, for milk, and for various other purposes, compared to physicians who consider the problem of avian influenza a public health issue, dealing with their consumers, which are, of course, their patients. So in Keck's view, in this chapter, he's sort of looking at this division between physicians and veterinarians, and how focusing on it as an animal husbandry concern leads to certain recommendations, and looking at it as a public health issue leads to other recommendations. And this gets into the broader public health concept of defining a problem. The way that we go about defining a public policy problem has a big effect on the types of recommendations or the types of programs or approaches that we would recommend for dealing with this concern. So the other sort of key terms from this chapter are prevention, precaution, preparedness. So those three, the 3 Ps are definitely important throughout the chapter. So I think those are the ones that I'll focus on the most, because those are the ones that are most tied into this sort of debate between the physicians and the veterinarians. Skip down. This is a pretty dense, for those of you who've read it already, this is a pretty dense chapter. So I wanted to kind of focus on the material that I thought would be most applicable for the type of work that you're doing. Some of it is written in kind of a very dense academic kind of prose, so I don't want to get too bogged down in that. Keck talks about how he is an ethnographer. He approached it from that perspective, and notes that he was surprised that avian influenza came to be problematized as a food safety issue, since it's clear that cooking the chicken is enough to kill the virus. So that has come up obviously in the United States recently as well. There's been a lot of concern about the potential for avian influenza to be able to be transmitted through milk. And for a period of time, we were engaging in sort of random testing of milk to test for the presence of avian influenza. So certainly we in the United States recently have taken a similar approach. He notes that the official reason is that after the first case of H5N1 in 2005, when the media spread the news of a virus that could be transmitted from birds to humans, the consumption of poultry fell by 20%. or organizations involved in the response had to reassure the public that there was no risk in eating chicken. So the key idea, or one of the key ideas in there, is obviously the role of the media, the way that the media sort of frames an issue to the public will have a big effect on the degree that they respond. So if the media raises a lot of concerns about consuming chicken or consuming milk because of the risk of avian influenza, that's going to concern some people. But by that same token, if the media is not covering those issues or is not framing it in that way, people will be less concerned. So the media can both create some hysteria at times, but it can also downplay an issue when maybe the public should be more concerned about it than it is. So the media is kind of a double-edged sword in that respect. And the issue of sort of government institutions or research institutions having to reassure the public or provide the public with accurate information. This is something that comes up again and again, when we talk about public health emergencies, whether it's COVID-19 or other situations that the United States has experienced. It's up to the government and research institutions to try to do appropriate risk communication to give the public accurate, actionable information. And that's something we're going to deal with in some detail later on in the class. So moving on through the chapter, by talking about avian influenza rather than bird flu or mad cow disease, rather than bovine spongiform encephalopathy, this organization at AFSSA in France responded to sanitary crises with clear and scientifically grounded information on food production. It covered the food chain from farm to fork. Since the risk to farmers who deal with live poultry are as important as the risk to consumers who eat dead chicken. So there again, you have this idea of, you want government, you want researchers, you want public health officials to be providing clear and scientifically grounded information. And at the same time, we want to take into account the concerns of all of the people who are involved. So they mentioned farmers, farm workers have been an area of concern with the recent avian influenza outbreak in the United States. For a time, the government, the federal government, state and local governments, we're trying to do some regular testing of farm workers to monitor for potential human infections. That may be still done in some states, but there was certainly concern that those people who were actively doing the work in the agricultural sector were at risk of contracting the virus and getting a human infection. So being mindful of all of the players involved in the system and not being just focused on one particular type of individual. Heck later on in the chapter talks about how his contention is that animal diseases introduce into food safety assessment a tension between two contradictory representations, the animal as good potential food and the animal as a dangerous living being. So certainly we see that in our discourse with avian influenza today. There's been a lot of focus, for example, on the cost of eggs. In the last presidential campaign, people were talking about the cost of eggs. I think egg prices have gone down here recently, but food costs still continue to be an issue. But animals, whether it's eggs, milk, meat, animals are, for many people, a key part of the food supply. So that is a concern if there's any risk of any of those elements being taken out of play. but also recognizing the potential for animals to make us sick, whether that's disease being transmitted through food or that's through wildlife, because avian influenza can be transmitted through wild geese, wild ducks, and things of that nature as well. So, on one hand, we depend on these animals. Many of us do for nutrition, but on the other hand, they pose health risks as well, both for consumers of the food as well as the people who are helping to produce the food. So finding the appropriate balance there when we're trying to come up with policy solutions that protect the public while at the same time disrupting our way of life as little as possible. The chapter goes on to talk about the domestication of animals introduced both a huge stock of food and a new site for viruses, similar to what we just talked about. And the reading talks about both mad cow disease and avian influenza. Mad cow disease is a very different kind of disease because it can only really be caught from consuming food, whereas bird flu can be transmitted similar to the type of influenza that we usually talk about, through exposure and breathing the air and touching things and things of that nature. So we're focusing on bird flu, obviously. So bird flu has shown that techniques of animal feeding, transportation, and slaughter bring with them new risks of transmission for emerging diseases. So again, being mindful of the types of practices that we're using in the agricultural industry. And there's been a lot of discussions over the years about biosecurity on farms and things that farmers can do to avoid, transmitting diseases from one farm to another, or transmitting diseases from the farm into other areas. How to keep animals from transmitting diseases among themselves. So that's certainly something that's been discussed and is continuing to be discussed. And in different countries and different areas of the US, different farmers have instituted different types of biosecurity processes to try to avoid those situations. Even if it's simple as putting on disposable covers over their boots. So you go into one building, you do your work there with the disposable boot covers on, and then you take those off and put on a new pair before you go into another building. That's sort of the most basic type of protection in terms of trying not to track viruses from one building to another. Again, just trying to cover what I think are some of the more relevant passages. Again, in the case of either mad cow disease or avian influenza, there's the debate over culling versus vaccinating. And in the US, we're kind of seeing a lot of opposition to both of these options. I've seen, there are federal government officials, Secretary Kennedy and HHS, being one person that springs to mind, sort of saying we shouldn't vaccinate the birds. And certainly farmers are against culling the animals, which would be, if you have an infection in a flock of chickens, you just kill all of the chickens in that flock to sort of stamp out the virus where it is. That's certainly not a popular solution either in the United States. So both of these obviously have moral and economic consequences. From the economic perspective, killing all of those animals has implications for the farmers in terms of loss of profit, as well as for the consumers, because the cost of meat and other products is going to go up. But from a moral perspective, people who are concerned with animal rights certainly don't want to see animals killed wastefully, unnecessarily. And from the vaccination perspective, there are obviously economic costs associated with vaccination. So those have to be considered as well. And there are certain people in the United States that obviously are anti-vaccination, have concerns about vaccination. So, introducing that into the food supply, some see as a moral issue. So there's this question of the articulation between sovereignty and biopolitics, which Keck talks about as the power to make die and let live, and the power to let die and make live. So the issue of do we kill these animals to protect people, or do we vaccinate in order to let the animals live, and what are the costs associated with that? He goes on to note that it presupposes this balancing act we're trying to find presupposes that the separation between humans and animals is not a fixed and given frontier, but needs to be redrawn following certain ideals such as public health and depending on specific contexts. And I think most people would say that this is true, that humans and animals, the relationship between humans and animals is not a fixed thing, that it does vary depending on the situation, depending on the illness involved, and depending on the level of infection and the threat posed to the public, and all those different factors would come into play. So some people would say with avian influenza currently, because it's not able to be transmitted readily between human populations, from human to human, that it's a relatively low level threat at this point, and that culling is not necessary. However, other people argue that culling is necessary, or vaccination is necessary, precisely because we want the virus to be transmitted within animal populations as little as possible, because the more it's transmitted among animal populations, between animals, the more chance it has to mutate and take on greater infectivity with human beings. Keck writes, food safety experts all consider public health as a good to be pursued for its own sake, since they are asked to evaluate the quality of the food and distribution. They mix forms of assessment that depend on scientific criteria with forms of assessment that draw on other regimes of normativity, relying on much more familiar forms of evaluation. They have different views of the good and different expert knowledges depending on their position in the spectrum that bounds animal health and human health. So to kind of break that down or try to summarize that a little bit, people, people in the food safety industry, it's argued, protecting the public health is seen as a good in and of itself, that it's important to protect the lives and well-being of people. That's just a given in any situation, which I think many of us would agree with. But because they see public health as a good in and of itself, they mix, to a certain extent, scientific data with more normative data, which is sort of their own personal beliefs or personal convictions. So, sometimes they may advocate taking a more cautious approach when dealing with public health threat involving animals, not necessarily because the science strictly says that they should take that approach, but because they're approaching it from a sense of greater caution, because they want to make sure that no human lives are unfairly or needlessly harmed. And coming at it from a different perspective, if you're looking at it from the agricultural sector or even the veterinary sector, you know, they may look at it from a more economic perspective or a more, you know, looking at it from the perspective of the animals themselves and saying, you know, if the data is not clear, you know, if it's kind of a toss-up at this point between whether we should cull particular animals or not, maybe we should err on the side of letting the animals live in those situations. So again, a difference of perspective, a difference of how we define the problem. Through, and again, I just want to focus on those points that I think are most directly relevant to your work and the questions that you're going to be dealing with. So it says here, the division between veterinarians and physicians on this issue should not be overemphasized. It cites Dominique Turk, a physician who runs the nutrition committee, works for milk companies, and admits that he cannot evaluate the safety of milk if he's not familiar with the technical and economic aspects of its production. He notes that we all have conflicts of interest, to suggest that talking about the commercial aspects of nutrition issues is what makes the discussion interesting. In a world of experts where economic interests cannot but interfere with pure science, it's better to speak of interested knowledge rather than denouncing conflicts of interest. So this is kind of an interesting point, because this often gets talked about, you know, when there's, you know, when scientific experts come into play, whether it's dealing with vaccination or whether it's dealing with climate change or, you know, any of these big scientific issues, there's discussion of conflicts of interest, that, you know, researchers are engaged with the pharmaceutical industry, so that creates a conflict of interest, or researchers are engaged with, you know, environmental groups, or they're engaged with the oil industry, so that creates conflicts of interest. The argument that's being made here is that, you know, physicians, you know, for example, in this case, you know, there are physicians that are consulting with the milk companies. So does that mean that these physicians don't care about human health? Probably not. But they are working with the milk companies, which introduces an economic interest as well. And it's argued that, you know, avoiding these kinds of situations is pretty much unrealistic. So we should look at the idea of interested knowledge. You know, we should look at this information that's being produced by these people who have these sort of mixed relationships, and we should acknowledge that there is a potential, you know, that the economic side of things may be taking precedence over the public health side of things. You know, we can still take those ideas into account, but we don't have to completely dismiss what they're saying because of a perceived conflict of interest. So you know, obviously you can feel about this however you want, but this is just one perspective on that issue. I think it's worth at least considering, given the discussion that is going on in the United States with avian influenza and a whole bunch of other issues as well. So it goes on, again, talking more about conflict of interest. Declaring a conflict of interest is a delicate task that can affect an expert's legitimacy for a long time. Since everyone knows who works for which company, it's considered better not to publicly declare one's conflicts of interest. Because they are suspected of taking the side of breeders on animal diseases, veterinarians are collectively accused of always being in a conflict of interest. But this accusation has no formal value and only displaces the tension between experts and other arenas of the agency. Therefore, the notion of conflict of interest displaces the opposition between experts from the scene of collective expertise to the halls of the agency, where it takes the form of rumor rather than public judgment. So there's obviously a lot there, but I think the key idea here is that, you know, again, you know, looking specifically at veterinarians, they're perceived as taking the side of breeders, people involved in the agricultural sector when it comes to animal diseases, and therefore some people dismiss their views as being self-interested or being conflicted. But the argument here is that by looking at it as a conflict of interest as opposed to the idea of interested knowledge, it ends up, the arguments end up playing out in these agencies, and it's more about rumors about, who's getting paid by whom, rather than who has the best judgment on the particular issue. So it's better to look at these things in the context of interested knowledge, and acknowledge the fact that veterinarians may tend to side with the breeders, but that doesn't necessarily mean that they're ignoring all of the other evidence as well. And all of those kinds of discussions are better off happening in public, out in the open, rather than being treated as conflicts of interest and everything's being handled behind closed doors. So again, going back to the idea of, we talked about the different ideas of preparedness and prevention and so forth. So it talks about veterinarians have traditionally practiced prevention. They've established a surveillance network based on epidemiology in which every single case in farm animals can be detected and analyzed, and they can intervene to minimize the risk of transmission in a population. And this is very important, and I would say it's equally important in the human population to have good public health surveillance systems to detect the emergence of new viruses. So certainly, in no way would I argue that prevention, as discussed here with surveillance networks, is in any way a negative technique to use for public health purposes. So that's sort of the prevention side. But then it goes on to say avian influenza presented an opportunity for veterinarians to use the logic of prevention in a new way. The question that they asked was not, is there a risk in the consumption of poultry meat, but how does the disease propagate and how do we stop it? So again, those people, physicians and public health personnel, are probably going to come at it from the perspective of, how big of a risk does the consumption of poultry meat have to the public, and what action do we need to take to make sure that no people are harmed? Whereas veterinarians with a more prevention focus would say, rather than immediately jumping to what do we need to do to protect the human population at all costs, says, wait a minute, how can we stop this disease from spreading, so that it doesn't reach the human population, but we also don't have to cull all of these animals. Physicians, as you might expect, look at it from a different perspective, introduced a new rationality of risk. If the H5N1 virus was of the same stock as the one that had killed 20 million people after World War I, referring to the influenza pandemic of 1918 through 1919, it would cause a worldwide pandemic with potentially 60 million deaths. And it should be noted that avian influenza, some strains in some situations, has been found to have like a 60% mortality rate. So it can be in some strains, in some situations, very deadly. So to avoid that, to avoid these effects, we need to take steps to mitigate the problem. So the question for physicians was not, is there a risk of mutation to human form, but are we prepared for this catastrophe, and what vulnerabilities would it reveal in the public health infrastructure? So again, immediately jumping into Are we ready to deal with avian influenza if it jumps into the human population and can be spread from person to person? And what would be sort of the downstream effects on society if this happened? So again, immediately kind of shifting into the potential worst case scenario for the human population. And if you're thinking in terms of worst case scenarios for people, and you're looking at it as a physician or a public health person, you're more likely to jump immediately to the idea of, we just need to go ahead and start culling these animals. So it concludes their physicians thus made the shift from precaution to preparedness. So immediately sort of getting on to more of a war footing and say, this virus is a potential deadly enemy. We need to take basically offensive action. Keck goes on to write, to foresee the epidemic means both to prevent its emerging forms and to prepare for its catastrophic effects. So buying masks to protect those who work in hospitals, collecting vaccines to cure the population, organizing hospitals so they can receive patients, schools so they can teach without students having to come to school, and businesses so they can continue to operate with a minimum staff. So it's important to note that this was written well before COVID-19, well before that pandemic took place. But obviously, a lot of this rings a bell. A lot of this is very reminiscent of the issues that we dealt with during that period of time. The need for greater supplies of masks, the need for vaccines, the need for hospitals to have the equipment and staff and to be set up, to be able to isolate people, schools going to online education, businesses, operating with fewer employees as much as possible. So certainly we've seen in real time, all of us, this sort of thing take place. And granted, it did, not necessarily roll out in the most strategic or organized fashion. We were, to some extent caught off guard by COVID-19. This is, in this perspective, it's saying, okay, we recognize that avian influenza is a risk, so we need to start implementing policies and taking steps to prepare for these things so that if this pandemic does come about, we're able to make these transitions in a systematic way. So this is again arguing for preparedness and having plans in place so that the disruption to society is as limited as possible. It's written here, veterinarians have been surprised by this new rationality of risk. They think that the money spent on preparedness should be dedicated to prevention, arguing that actual problems require more attention than virtual catastrophes. So basically, the veterinarian perspective is rather than spending a lot of money preparing for a human pandemic involving avian influenza, it's better to devote our resources to stopping the spread within animal populations, because the spread within animal populations is a real ongoing concern, whereas at the time this was written and even today, the sort of human pandemic involving avian influenza is still theoretical. It hasn't happened yet. We haven't seen sustained person-to-person transmission yet. So while physicians talk about avian flu to insist on its possible consequences for humans, with symptoms very similar to human flu caused by broadly spreading virus, veterinarians talk about avian plague to suggest that these new kinds of symptoms were already present in many animal diseases. So basically, veterinarians are saying, this virus and other viruses have been affecting animals for a long time. This is an ongoing problem that we do need to take steps to address, and we need to devote resources to. Whereas, the idea of avian flu, spreading similar to the sort of human flu that we're accustomed to, that would be more of a novel situation. So again, sort of comparing the sort of novelty of a human avian influenza outbreak to the sort of ongoing realities of the spread of viruses within animal populations. A veterinarian, it cites a veterinarian, it says a veterinarian was thus lambasted by the president of a commission. The veterinary world should not treat this question in a spirit of competition with the world of public health. Underestimating human pandemic to support the problem of avian flu is the wrong way to communicate. The veterinary world has things to say, including on humanitarian and economic grounds. If you want to help these countries restore their food supply, that's fine, but that doesn't mean you should underestimate the risk of human pandemic to get the message across. So that's pretty clear. So again, you see this debate playing out in a public way, somebody making a very direct kind of public statement saying that, just because the veterinary sector has a particular view of this, to win the argument, they shouldn't be underestimating the threat to people. So avian influenza, and it's important to note that in this context, AI does stand for avian influenza. I know that's, now it means something very different, but it's important to note that that's what it means in this context. Makes prevention necessary not only at a local and symptomatic level, but also a global and genetic level, which makes it possible to say that the H5N1 in one area is, could be from the same lineage, the same strain, as the outbreak in another country. So you could have similar strains of the virus infecting two different countries at once, creating a global issue. So, we need to deal with prevention at a local level, dealing with, what's going on with flocks in our community, but we also need to be mindful of, transportation issues, both human and animal transportation, and the spreading of the virus across geographic boundaries, which, certainly, as we've seen with COVID-19, facilitated the spread of that virus around the world, and we want to be mindful that we prevent that from happening again. But we also have to be mindful of, keeping an eye on what's going on in our own communities, because there's always going to be an original source of the virus, and that original source could be pretty much any farm in any community. So, it talks about the two rationalities of risk, prevention and precaution. It talks about a situation where a cattle herd was culled because of mad cow disease. The veterinarians were in favor of selective culling, whereas the physicians were for the total destruction of the herd. So again, it comes down to the veterinarians being like, in our view, we don't have to kill all of the animals. We should just, for the time being, eliminate those animals that are showing symptoms. But the physician saying, we can't take the risk of these animals potentially getting into the food chain and infecting human beings. We have to eliminate all of them. So again, these two different worldviews coming into play. As the director of a health agency explained the logic of precaution was necessary because it restored the public trust. It protected the government from all critics that might accuse it of endangering consumers, and the responsibility was delegated to the experts. So, sort of inherent in this statement is the idea that maybe there was a recognition that killing all of the animals or culling all of the animals actually wasn't necessary from a scientific perspective or a health perspective, but it was necessary from a public relations perspective, a consumer confidence perspective. By eliminating all potential threats, you make people more comfortable with continuing to eat meat, and then you can blame the public health experts for the decision. So people in government, whether elected officials or people in agencies, don't take an inordinate amount of the blame. So again, total culling could reassure both the consumer, to whom it was explained that a radical measure was taken in the countries to which exports were made. So that's another element, international trade. So if there's any concern, looking at it from the American perspective, if there's a concern that American beef is perceived as unsafe by other countries and therefore they won't import it into those countries, that's going to have negative effects for the US economy. So you want those countries to be comfortable importing US products. I know somebody who disagreed with the policy saying you control an animal disease mechanically. With mad cow disease, there was massive culling, which became morally unacceptable for our contemporaries. For veterinarians, the massive culling showed that precaution was a moral, not a scientific principle. It reassured consumers even though it shocked their sensibilities. It was not a technical measure, that is a way to limit the propagation of the infectious agent. So again, this idea of killing all of these animals, not necessarily because it was scientifically necessary or necessary from a public health perspective, but because the consuming public basically demanded it, even though the public doesn't necessarily like the idea of animals being killed senselessly and wastefully. They don't like the idea of getting mad cow disease or avian influenza even more. So ultimately, consumer confidence ends up winning out in that discussion. So kind of a long passage here. So an agency published a recommendation, and again, this is referring to the France example, published a recommendation in which veterinarians claimed that the risk of transmission was not high enough to justify the confinement of poultry farms outside of the zone where the first H5N1 virus had appeared. They said they would reconsider the measure in light of epidemiological data. So on October 15th, 2006, the Minister of Agriculture decided to impose confinement on farms in 21 departments, which I think would be kind of the equivalent of states within France, arguing as far as confinement is concerned, we lean heavily toward the application of the principle of precaution. If we have extended confinement, it's not only because of the events in Turkey that had 97 infectious cases, but also to prepare our farmers for a return of migratory birds in February and encourage them to think about the way they work. So that's referring to the idea that birds on farms, animals on farms can be infected with viruses by wildlife. So in this case, domesticated birds for agriculture could be infected by wild birds that are migrating from other places. The government argument mixed the rationalities of precaution and preparedness. The limits of precaution were pushed so far that it became preparedness. Precaution would imply building a space of transparency in which the conditions of dissemination of the virus could be studied. So the government, rather than taking a more kind of targeted approach or a more selective approach, sort of took a wide perspective on confinement. So similar to the idea of do we only cull certain animals or do we cull all the animals? This was, rather than confining just a few places, we're going to confine any place that could potentially be infected. And we're going to do that not only to deal with the potential risk that currently exists, but also to prepare for the risk that may be coming, which is, where they're talking about mixing precaution and preparedness. So again, should the government take, more selective steps or broader steps in dealing with these situations? In the abstract, a lot of us might be prone to say, the government should be more selective, the government shouldn't be overreaching and things like that. But then, when you're thinking about it in the context of your own family and the potential threat of getting avian influenza or, even mad cow disease, when that risk becomes more concrete, sometimes that changes our perspective on things. So it talks about the alternative to culling being vaccination, which is something that is being considered here in the United States as well. Whether flocks should be vaccinated or not, whether the government should, federal government should promote vaccination, or the degree to which government should help to facilitate it. It notes that vaccination is possible for avian influenza since the virus is perfectly known, but it does have costs involved. Animals who have been vaccinated cannot be transported for a certain period, and distributors fear that consumers might not want to buy meat that has been vaccinated, which is certainly a concern here in the United States with certain segments of the population. Vaccination of animals requires identification in a form of surveillance and tracking. It implies an economic rationality. What is the benefit of the vaccination in relation to the cost? Which is something that really with public policy is always a consideration. We always should be thinking in terms of costs and benefit. When China announced that it would vaccinate 13 billion chickens, an announcement criticized by all other countries as unrealistic, it pushed the logic of prevention to its limit. But the question of vaccination is totally different if seen from the vantage point of pandemic preparedness, since it becomes a question of human vaccination. So again, it's the idea of if we're thinking just in terms of the animal population and whether we should vaccinate or not, there's sort of the need to balance the economic side versus the health side. But then if we put it in the context of do we need to vaccinate in order to prevent a human pandemic, then it takes on a whole other dimension. So again, when you bring in that worst case scenario and define the problem that way, it has big effects on people's ultimate resolution on the issue. So again, the question of vaccination becomes an ethical one. Who will receive vaccines first, and how can the population be convinced to wait until adequate vaccines are produced? So that's certainly something that we saw play out during the COVID-19 pandemic, when they were getting ready to roll out the COVID-19 vaccines. There were questions of who should get them first, and how do we assure equitable supplies of vaccines, not only within the United States, but around the world. And a lot of people would argue that we certainly failed on a global perspective, because there's some parts of the world that really never received the COVID-19 vaccines. So Keck goes on to write that his hypothesis is that biosecurity introduces the rationality of preparedness into a field that was formerly structured by the opposition between prevention and precaution. So, again, so introducing that idea of preparedness in terms of trying to prevent a massive, human pandemic compared to the normal types of preventative measures that farms take, and sort of, recognizing when there is a risk and taking appropriate actions to deal with that risk. But when you look at it from the preparedness perspective and kind of the pandemic worldview, it changes the way that biosecurity is talked about and the types of policies that become feasible. So it goes on to reiterate that the structure of the H5N1 virus is perfectly known. It's been analyzed since 1997, but what's not known is when it will mutate into a form that can, facilitate human-to-human transmission. Therefore, the security measures aim at delaying that moment of catastrophe. And there's a quote there: "For avian influenza, it's a classic science fiction film scenario. We know all the amino acids, we just don't know how they'll combine. Hence the role of wild fauna, where a combination can occur. We can assess the risk when we know what animals have been involved. Avian influenza moves very quickly. We have to be very calm when people talk about virus bombs. Mad cow disease moves very slowly, it has great inertia, and we need to think quickly to stay ahead of the disease." So again, the idea of, we need to be mindful of, we don't know when the virus could potentially mutate into a form that can be passed from person to person in a sustained way. There are a lot of wild animals out there in which the virus is sort of recombining and mutating all the time. So, we do need to be calm, but we also need to be thinking through and planning and preparing for the day when avian influenza becomes a serious threat to both communities throughout the United States as well as to the larger world. So it goes on to say, when veterinarians redraw the itinerary of the H5N1 virus, they point to China as a rogue state where information is concealed and sanitary practices are considered dubious. And based on the COVID-19 experience, that sort of perception, I think, prevails in the United States. Regardless of what you think the origins of COVID-19 were originally, whether it came from the wet market or whether it came from a lab, China was not forthcoming with the information that they had about the spread of the virus with the international community. And, again, whether it came from a wet market or a lab, there was a lapse in sanitary practices somewhere. So biosecurity for animal diseases implies a politics of declaration and suspicion. If the H5N1 virus concerns the world community, all countries have to declare both their animal cases and their human cases to the World Organization for Animal Health. And countries that declare only human cases, such as Indonesia, are considered untrustworthy. So ideally, there would be sort of global transparency between countries. But we know from past experience that this is unlikely. And with the United States no longer being a member of the World Health Organization, the likelihood that the US would be quick to report the outbreak of a new virus or the mutated form of avian influenza or something like that is decreased from what it would have been when we were members of the World Health Organization. So the US is a question mark to many countries as well when it comes to transparency on this issue. So with biosecurity, it's problematized by veterinarians for avian influenza. Nature is seen as proliferating diseases. Migratory birds are suspected of propagating the virus. And those who live closer to animals are considered most exposed to the disease. Therefore, biosecurity measures, which can include confinement and sanitary cleaning, are aimed at limiting this proliferation. So again, from a veterinarian perspective, the migratory birds are the real risk. So keeping those away from animals raised for agricultural purposes, protecting people from interacting with those migratory birds would be a key concern from a veterinary perspective to prevent that sort of breakout event where it goes from a migratory bird to a person. So Keck writes here, one possible answer for the biosecurity dilemma is an encompassing form of power, a waste of time and money in the name of an imaginary catastrophe, and that the social sciences have to give voice to those who suffer under biosecurity measures. So, some people argue that, biosecurity can go too far. This preparedness for a pandemic can result in a waste of time and money to combat a potential catastrophe that may not happen, and that more focus needs to be on those who are harmed by that sort of government overreach. So that's one particular perspective on the issue. Keck writes that the chapter contends that biosecurity should be situated in a conflictual field of discourses and practices in which the question of its social and human cost is raised by the actors themselves, and which it transforms in light of a future catastrophe. Biosecurity does not have the same meaning when it's used by veterinarians who refer to the responsibility of breeders, or by physicians who organize a pandemic plan for hospitals. They both refer to the same virtual event, the mutation of the H5N1 virus to a form that can spread between people, but they see it from opposite points of view in the chain of production of human beings. Food safety crises offer a window on these varying perspectives by revealing the potential tensions in the Alimentary Act, the Alimentary Act, sorry, I mispronounced that. The two poles, production and consumption, are both united and separated by health crises. So, again, the idea that we need to be mindful of the effects that these biosecurity measures can have on farmers and other people involved in the agricultural sector and food production sector, and potential harm, economic harm and social harm that can come from those. But at the same time, we have to be mindful of the fact that the healthcare system needs to be protected, and the healthcare system needs to be prepared in the event that avian influenza does become a pandemic that spreads from person to person. So the power is necessary, and the power must be wielded to some extent, but both sides of the arguments need to be considered when we're looking at different policies. So then it gets into the role of the social sciences with biosecurity, which kind of gets into our field, or rather my field, since I specifically am in the social sciences. So it says, among the tasks is first to offer a genealogy of its emergence on a pre-existing field of social relationships, talking about biosecurity, so as to bring to light the potential tensions and actual contradictions that account for both its fragility and dynamism. So social scientists basically need to be clear on the fact that there are areas of conflict in biosecurity, and there are also areas of contradictions within biosecurity, and that needs to be made clear, and that needs to be directly addressed. Second, to clarify its conceptual meaning in a given domain of public health, where it captures practices and distributes responsibilities in ways that are not yet established. So going back to that point, to clarify what biosecurity is within the public health realm, and being clear, what practices it encompasses, who has responsibility for implementing those practices, So providing more clarity in that area. And then third, to found it on some universal anthropological tension so that the similarities to and differences from other discourses and practices in the world can be made meaningful. So again, from an anthropological perspective, looking at it from the perspective of, different constituencies, different groups, the farmers, the doctors, the public health workers, the meat packers, all these different groups are involved in this biosecurity issue, and they're all affected by it in different ways. So acknowledging the fact that in enacting policy for biosecurity, all of these different groups are being affected. And some of them are being more affected by certain policies than others, and we need to be more cognizant of that idea. So, again, he's talking about the different perspectives. So for veterinarians, helping a breeder give birth to a calf, or physicians refusing to be bribed by pharmaceutical companies. So, they have different perspectives on, what their profession means, whether it's, helping to bring new life into the world, or from the physician's perspective, trying to maintain their integrity in the face of potential conflicts of interest. And it's noted by Keck that biosecurity lacks this form of experience, since it puts all the blame on the breeders. So all of the responsibility is placed on the farmers, and prepares for a catastrophe that is still theoretical, although after the COVID-19 pandemic, we certainly have to acknowledge that such a pandemic risk is certainly real. And it's the rationality of risk that's not been tested in reality. So again, this was written prior to COVID-19. I don't know that Keck would reevaluate any of this in light of COVID-19, but certainly at the time he was saying that the rationality of risk when it comes to avian influenza needs to be reconsidered. I think that's it for this particular reading. So again, this was a pretty long reading, a pretty dense reading. I tried again to focus on the points that I thought were going to be most relevant to your work as you're moving through the weeks of the class. But if anybody has any questions on anything that I've covered, please let me know. Thanks very much for watching, and I'll see you next time.